So estrogen will reduce heart disease by a 40 to 50% overall risk. It acts as a natural calcium channel blocker, so blood pressure, energy, mood, concentration, bone strength. It will lower bad cholesterol. It aids in the formation of neurotransmitters such as serotonin, and it decreases depression, irritability, and anxiety. And not enough estrogen, hot flashes, night sweats, brain fog, belly fat, vaginal dryness, poor libido, headaches, wrinkles around the mouth, increased blood sugars, increased blood lipids, and increased heart disease. Too much estrogen, we talked about cysts, so ovarian cysts, uterine cysts, which are fibroids, endometrial cysts, endometriosis, irregular menses, elevated estrone. So estrone, there's 3 types of estrogen. Estrone is the bad guy, and that's the one that will cause accumulation of fat in the belly, weight gain, and in men, prostate enlargement, and then what we call emotional lability and tearfulness. So that's estrogen on the fly. Progesterone, we talked a little bit about progesterone. It balances estrogen. Basically, that's it. It improves sleep. It has a calming effect. It lowers blood pressure. So our patients are perimenopausal patients, early postmenopausal patients. When they come in, they're agitated and they're irritable and they hate the kids and they're kicking the dog and they're screaming at the husband and throwing oven racks at them. And they went to their doctor and they got Prozac and they got Xanax and they got Valium. God didn't make a Valium deficiency, but it takes a little bit of time. It takes a couple of weeks, but about 3 to 4 weeks of adequate progesterone, and all of a sudden, all of the symptoms go away. And Lisa, I know, in fact, I've listened to it this morning. I know you've had Carol Peterson on.
Yeah, yep, she's brilliant.
And yep. She uses a lot higher doses than I do, so I'm slowly getting there. So progesterone is your savior. Progesterone is our friend, and progesterone is one of the main remedies that we use for that polycystic ovaries that we mentioned earlier. Low progesterone is actually thought to be the cause of breast cancers, not high estrogen. And remember, it's a balance, but low progesterone, 10 times the increased death rate from all cancers with patients with low progesterone. And this is 700 patients followed up for 33 years. I mean, that's a long time. 5.5 times increased incidence of breast cancer in premenopausal patients with low progesterone. Progesterone deficiency, I just mentioned it, agitated, irritable, can't sleep, or libido, headaches, short-tempered, depression, mood swings, and then the symptoms of excess estrogen, which we've already just mentioned a number of times. Usually too much progesterone it isn't usually a problem unless we've been treating someone with progesterone and we've sort of overshot the mark, but you can get some bloating, you can get some depression. Basically you're going to feel drunk or hungover. That's usually the symptom, and sometimes some water retention also. So I did a whole lecture on pros and cons, because in the U.S. the standard is if the patient's had a hysterectomy, they don't get progesterone. And so, in fact, I was at a panel discussion, and the endocrinologist said they don't have a uterus, they can't get pregnant, they don't need progesterone. Well, all of these issues here are what happens when we have adequate progesterone. So, increased diuresis, blood pressure, smooth muscle, sleep, memory. Again, in head injuries, it reduces neuronal blood loss. It's an anti-inflammatory. It regulates your brain chemicals. It keeps you calm. It improves thyroid function, and all of it prevents all of these things over on the right. Breast cancers, memory loss, slowed thought processes, stress, anxieties.
Oh, we lost you. Hey, Dr. Bill.
Good stuff. And for OBGYN specialists don't know this, at least not where I live. I may pop out here. It says my internet connection is unstable, and when we're running our things, it sometimes drops out. So I'll come back if I get lost. Okay.
Yep. Cool.
Growth hormone. So here's Here's another. So growth hormone stimulates cell growth and cell reproduction. Growth hormone actually deals with strength, energy, sense of well-being. It's why our baseball players, when they were taking this stuff, get hit 45 home runs when they were, or 75 home runs when they were 45 years old. That's not natural. But what we look for, in our practice mostly is for what is known as executive function. So the ability to plan things, or if it's low, the inability to plan things, obsessive compulsive tendencies, the ability to start projects, the ability to finish projects easily or not, the ability to multitask. That's growth hormone is adequate growth hormone is key there. And that's what this is here. And this is what there's a big disconnect, especially in autistic kids, where they have a lot of growth hormone, it's high, but the IGF-1, which is the usable portion, and again, we're just giving an overview here, so I'm not going to get too technical, is actually low. And there's a block in that pathway, and that's the reason that these kids have all sorts of behavioral issues. Thyroid, I got 15 minutes, huh? So what does the thyroid do? So patients come in and they'll say, I've had thyroid disease for 30 years, and I ask them what the thyroid does, and I get all sorts of answers. But in 4 words, the first 2 was, it's your, slide's missing, gas pedal. That's what it is. It's your gas pedal. It's your energy, right? It tells your body how fast or how slow to go. There's 4 types of thyroid molecules, 1, 2, 3, and 4. We only deal with 3 and 4 because we don't know what to do with 1 and 2. The T there stands for tyrosine, which is a protein. It's not thyroid. The numbers stand for the number of iodines attached to the tyrosine. The 3 is the part that does the work. The 4 is the store unit. Thyroid also makes calcitonin, which produces calcium, which is always left out, at least here, because according to the specialist, all we're supposed to use is Synthroid, synthetic thyroid, which is just T4. So T4 converts to T3. That's how you get most of your T3, the usable portion, but not all of it. And then one of the side effects of long-term use of Synthroid is osteoporosis, because you lose calcium. Well, you lose calcium because we're not replacing it, because the thyroid, it makes calcium, and we just forgot about it. This is just a schematic of a thyroid molecule. This here is, it looks like a sort of a stick man here. This is that tyrosine. Any type of thyroid supplement should have this in it. Okay, here are the iodines. Here's the 4, here's the 3. But notice over here, there's another 3, but it's upside down. This is an inverse T3 or an active T3. We call it reverse T3. And 90 to 95% of the time, it's produced from too much cortisol, stress hormone. So I use this, actually, we order this reverse T3. I use this as a proxy for cortisol, and it works quite well. The standard is either draw cortisol levels, and that can sometimes be tricky, or there's a saliva test. I'm sure you're familiar with it. Some of your, where we have you spit in the tube 4 times a day, and it'll give us how much cortisol there is, and there's a graph you get, and then you follow it from a norm. It's $250 in the US. None of the insurances pay for it. This is about $8. It comes with the regular thyroid test. It's 90 to 95% accurate. So
it's
we
more
can use
over here.
Here's the symptoms of thyroid disease. So you need to be Goldilocks, not too much, not too little. For hypothyroidism, it's dry skin, dry hair, fingernails crack and break, constipation, can't lose weight, cold all the time, tired all day long. 98% of the time, the patients that we see have some, if they come in with a thyroid issue, it's low thyroid. That's pretty much why we just pay attention to that. It's just the opposite. So you're speeded up if you have hyperthyroidism. So you have rapid heart rate, bulging eyes, sweating, soft nails, diarrhea, losing weight. So it's pretty much the opposite. By the time they get to somebody like me, the only time they're hyperthyroid is if we gave them too much thyroid supplement. The medical model versus what we look at. So the medical doctors tell us that it's a failure to convert T4 to T3. The only thing you need to look at is TSH, which is thyroid stimulating hormone, which is the hormone that's made in the pituitary. It's the detective. It detects how much is in your system. If you don't have enough, your brain will tell you to make more. If you have too much, your brain will tell you to make less. So that number that we get is an inverse. So I don't remember the units off the top of my head, but 0.4 to 4.5 is sort of the parameters. 4.5 means you're low. 0.4 means you're high. Patients will get their lab values and they'll see it's 0.3. Oh, my TSH is low, so they'll take more thyroid medication. Well, then it goes lower because it's an inverse. We look at all of these things on the right. So we look at diet and particularly gluten and gliadin. We're looking at oxalates now also. Toxins. So in the U.S., it's arsenic, mercury, cadmium, aluminum, and lead. Those are the big five there. Infectious disease, the number one is Epstein-Barr virus. So kids that had mono in their late teens or early 20s, 10 years later end up with autoimmune thyroid issues. But other things, hepatitis, and hepatitis can be chickenpox. It could be herpes. It could be cold sores. Lyme disease. The one we like to see is H. pylori, because we've actually treated H. pylori and had the autoimmune thyroid disease disappear. That's pretty much the only one we've actually had a quote unquote cure on. And Yersinia, which is food poisoning. HPA axis, so this is your cortisol abnormalities. Iodine deficiency. I can go into a whole hour on iodine, just on iodine. Doctors, at least in the U.S., are what we call iodine phobic. Iodine's going to kill you because they, again, another genius thing that happened in the late 40s and early 50s. They decided that iodine was a toxic poison. These scientists used radioactive iodine and injected rats with it, and of course the thyroids died, and so they decided that food grade iodine did the same. At the same time, there was a big push for fluoride in the water supply here in the U.S. Fluoride and iodine, or if you remember your chemical table, are chemically the same. So our brains got all mixed up, and it took 5 years, and there was a full-blown Hashimoto's thyroiditis crisis because we took iodine out of the food supply. We put fluoride in. Our bodies thought that the fluoride was iodine until it realized it wasn't, and then there was the cavalry came, and which is our immune system, and it was set off a full-blown crisis. Incidentally, when we took the iodine out of the food supply, there was a massive increase in breast cancers also, because breast tissue responds very nicely to adequate amount of iodine, and it keeps everything nice and calm. And certain medications. This is the workup if you're interested in it. You need to do all of these things, not just the TSH. There's that reverse T3. These are your antibodies here for your immune system. B12, folic acid, and ferritin and iron stores are necessary, as is vitamin D. This is that reverse T3. I sort of alluded to it quickly. Again, we use as a proxy for cortisol or stress hormone. These are your antibodies that we owe, TPO and antithyroglobulin. If they have hyperthyroid symptoms, we do something called a TSI, which I always forget what that means, and then a B12, folic acid, and iron. This is the schematic that we use. In the yellow, this is your regular medical doctor. So they'll tell you if the TSH is greater than 10, remember, high numbers are your low. We'll give you Synthroid. If it's 3.5 to 10, if you have those symptoms I mentioned, we'll give you Synthroid. If it's under 3.5, or 4.5 rather, it's 4.5 to 10. If it's under 4.5, you're crazy, go see a psychiatrist. These are all the things that we do. And we look at things like, so a lot of times, quite frequently, about 80% of the times when there's thyroid disease, there are GI issues, food sensitivities, small intestinal bacterial overgrowth, and all sorts of GI disruptions. And so we always look at anybody who comes in with a GI issue, we look at the thyroid. Anybody that comes in with a thyroid issue, we look at the GI symptoms. We'll use levothyroxine, just the T4, but we'll look at T3, which is the part that does the work. We'll look at combinations. We like using plant sterolins, which are dampen the autoimmune effect. And we have actually a whole lecture on low-dose naltrexone if you're ever interested in that, in that. White flour, white sugar, dairy, those are the bad guys. Sugar, soy, and corn, they're the bad carbs. Food sensitivities. How are we doing here, Lisa?
Yeah, I think we'll have to wrap it up.